Lung cancer signs and symptoms can be triggered when cells start dividing uncontrollably in the lung area. You're more at risk of developing this condition if you smoke, which accounts for 85% of all cases. Being around other people who smoke, passive smoking, or being exposed to radon can also increase your risk. This cancer is also one of the most common and serious types in the UK. You should watch out for these 5 symptoms of lung cancer, including a persistent cough, as detailed by the NHS. Persistent cough: if you have a cough that doesn't go away after 2 or 3 weeks, or a long-standing cough that gets worse, this could be a sign of lung cancer. Cancer Research UK added a change in a cough you have had for a long time could also indicate the condition. Chest infections: getting regular bacterial infections in your chest may also indicate lung cancer. A chest infection is an infection of the lungs or large airways, said the NHS. Some chest infections are mild and clear up on their own, but others can be severe and life-threatening. Coughing up blood: this can be alarming, but isn't usually a sign of a serious problem if you're young and otherwise healthy, said the NHS. It's more a cause for concern in older people, particularly those who smoke. This could come up as small amounts of bright red blood or frothy blood-streaked sputum. Breathing problems: an ache or pain in your chest while trying to breathe could also indicate the condition. The American Cancer Society adds that this pain may be worse with deep breathing, coughing, or laughing. Persistent breathlessness: being out of puff regularly may also be a sign of lung cancer. There are usually no signs or symptoms in the early stages of lung cancer, said the NHS, but many people with the condition eventually develop symptoms including a persistent cough. Having unexplained tiredness or weight loss could also be a symptom of the condition. Most lung cancers do not cause any symptoms until they have spread, but some people with early lung cancer do have symptoms, said the American Cancer Society. You should contact your GP if you think you might have this condition.